This is the Langley Mobile Overdose Prevention Site, one of several that have opened up across the Fraser Health region in response to the toxic drug crisis, which in 2023 killed more than 2,500 British Columbians. Now, a site like this offers people a place where they can consume their own substances under the watch of trained staff. It's a place that saves lives. Let's take a look. The Mobile Overdose Prevention Site is nestled into the corner of the parking lot at Langley Memorial Hospital, a small setup tucked beside the trees. For those who visit, it's a vital service. Hey Terry.
Hi there.
Thanks for having us. Terry is with Lookout Housing and Health Society, which operates the site in partnership with Fraser Health.
Right here we have a specially designed a van that can accompany medical appointments, community referral appointments and the like in a private space. And also we have people who actually are witnessed with their injection.
People can use these services completely anonymously. Inside the van, there's a sink with running water, clean harm reduction supplies like needles, naloxone to reverse a toxic drug poisoning, and a first aid bench. Jennifer, you're part of Fraser Health's harm reduction team. Can you just take me through why services like this one even matter?
These services are super important for people that use substances because we're able to actually respond in the moment if there's a toxic drug poisoning event, as well as providing that education, referrals, and connections to other services of care. So often this is a first point of contact for people in accessing healthcare. There are so many benefits for the community in terms of the spread of communicable disease, as well as preventing these really preventable deaths.
And there are more than 500 visits here every month. For people who, this might be something new, they might not know that this is going on. Yeah. What is witness consumption?
It is the act of actually supervising people so they don't overdose, and we're all trained in overdose interventions. So if someone does happen to overdose, then we're able to intervene quickly, safely.
Drugs are not provided at overdose prevention sites. People bring their own substances.
It's a life-saving service that is really required. And Langley is very high, has a high incidence of overdose deaths. And it's a place where people can come and not be stigmatized by their use. They don't feel judged.
It's one step on the continuum of care.
While keeping them safe and making sure that we're addressing a healthcare need and an urgent life-saving service, we also, we can make those linkages to primary care, to addiction services, to mental health services.
The site also offers people a chance to have their drugs checked. Eris, you're with Mountainside Harm Reduction Society, and you guys actually provide drug checking services here once a week.
Yes.
How does that work?
People who use drugs, both full-time, street entrenched, and hidden population, come to us, and they bring a small sample of whatever substance that they've used or plan on using, and we put it inside of a machine called a FTIR, or a Fourier transform infrared spectrometer.
The machine and software analyze the sample and determine what is in the substance.
We're in an illicit drug market. People don't know what they're buying. There is no ingredient list on the side of the baggie when you pick up your drugs. So it matters because we can tell you some of the ingredients that are in your drugs. It's killing a lot of people nowadays. And it's really important to know what you're taking.
In the Fraser Health region alone, 699 people died of toxic drug poisonings in 2023. 45 of them died in Langley. When overdose prevention sites first open, there can often be concerns about how it will impact the surrounding community.
What research tells us and the evidence tells us is that we actually see a decrease in public drug use. And we actually see a decrease in inappropriately discarded sharps and other harm reduction supplies. So often we actually see a reduction in some of those community complaints in and around the areas when we open up sites like these.
On top of that, it saves lives. Across Fraser Health, there are 12 overdose prevention sites.
The biggest critique that we hear about harm reduction is that it enables people who use substances. And we like to reframe that in that we're enabling people to access care.
Looking to the future, Fraser Health has a goal of offering witness consumption services in all its communities.